Welcome back to New Day Cleveland. Eczema. It can be a real problem, especially when it comes to children. So here to help us is Mary Helton from Apex Skin this morning. Mary, thank you so much for joining us. She's going to pop up here. There she is. Hi, how are you?
Good, how are you?
Good. It's good to see you. And you know, this is something that, as I teased this earlier in the show, everyone in the studio, they've talked about their children at points or another developing eczema and having this. So it's a fairly common thing.
It is, yes, very common actually.
But the problem is then it's nothing we want. So how do you fix this? I mean, when do you start seeing children develop this? At what age? And how do you go about tackling it?
Sure, yes. So, with eczema is, it's an umbrella. So under eczema, there are several different types of actual eczema. What we see most commonly in our children is actually something called atopic dermatitis. Most of the time, I mean, I can see that in infancy as early, as just, a few weeks old. Most of the time I start to see it around 6 months, between 6 months and 5 years of age. But I definitely have seen it before then, and I have definitely seen it after then. Some children develop it, and then they actually, in a sense, almost, kind of outgrow it a little bit. And then I do have patients where it actually continues into adulthood. And so they end up kind of being lifelong patients, which is fun for us.
Well, I can't. So we just pulled up a full screen, and it showed on there, too, how it can even cause things like allergies. I don't think I realized that.
So there's kind of a nice little triangle where some of our children that do have eczema can develop allergies and also asthma. So that's why it's important to make sure that eczema is diagnosed properly, because we also work very closely with pediatricians as well as allergists to make sure that those kids, if they do have other health concerns going on, that they're treated appropriately.
What's the most common way that you are treating it? Is there multiple ways to treat it, or is there one single shot way that kind of works the best?
So it is completely different per patient. So every child is going to be treated differently. And that's why, as dermatology providers, we have to very carefully assess each patient. And there are some really wonderful options, today that we didn't have a while ago. In addition to our topical medications, we have some non-steroid based options that are great. We have, light-based therapies that some patients utilize. There are some injectable medications that we do have for some of our older kids that have eczema. But a big part of the appointment is more or less discussing what things that our parents and our kids do at home to help treat the eczema. So bathing schedules, things that children have to stay away from. They have to limit exposure to types of moisturizers and emollients to use, and things along those lines as far as, like I said, that parent and patient education.
I know. Is it something that... I don't think that it is, but I want to ask you to be safe. Is it contagious? Is it something that other kids, when they have a friend or a brother or sister who has it, can they get it?
So absolutely not. And that's
I didn't think so, but I'm glad. I think it's still something we need to discuss.
It is actually. You know what? And it's the best question that I get, because it's actually my favorite part of the appointment, where we actually have to sit there, and most of the appointment is talking with our parents, about educating them and how they take care of their child. But that part of the appointment, we gear more towards the actual patient, the actual child. And it is so important for them to understand that, no, this is not something that they're going to give to someone else. They are not diseased. They are not dirty. This is just a wonderful part of their skin, and really involving them in their own health care is so important, because, I mean, with any patient, it's, research has proven that if they're involved in their own health care, that we're going to have better outcomes in the end. And so that's actually one of the pivotal parts of every appointment, is that patient education.
Good to know. So the first step would be to just give you guys a phone call when they see it. At the first signs of seeing any kind of irritation, correct? They should be giving you a phone call to just have it looked at.
Yes, because eczema can look, it looks different in every patient. So if a child is exhibiting that red, dry, very itchy skin, we kind of say this is the rash that itches, or the itch that rashes, sorry. And so if we do start to see those signs, that, yeah, definitely call somebody in the dermatology field.
Well, again, Mary Hilton there, a nurse practitioner there with Apex Skin. It is always a pleasure dealing with Apex Skin. You guys are all the doctors we deal with are absolutely wonderful. So thank you so much. Appreciate you joining us this morning. You guys are always so knowledgeable on the topics that we discuss. You have a wonderful day.
Thanks for having me. You too.
We'll see you soon.